Okay, so this is when I would walk in and then ask if I could do a newborn assessment, ask the mom, and if she says yes, I'd go ahead and wash my hands and then put on gloves and then check the wristband for ID with the mom, and then I would assess for the psychosocial status of the family and the mom and how the mom and the baby are bonding, and then I would note the infant's state of alertness and behavior, and then ask about how breastfeeding is going or if they're doing formula, and then how often the baby is feeding. So I'll do the head to toe, which is the head first, and I would note the shape, and then if there is any abnormalities on the top of the head, the sutures, and I would check the nose for patency, and then the eyes, I would check if the pupils are reactive, and then if they're even to like the ear. And for the mouth, I would check if they have teeth, if there's any cysts, the Epstein pearls, and then the frenulum, which you talked about, if it was getting in the way of feeding. And then for the extremities, I would check for the fingers and then the toes, if there are any additional fingers, the polydactyl and syndactyl. And I would check for nail length and sole creases. And for the, the respiratory, I would check these regular 6 spots. It's kind of small. Yeah, and then the side. And that should be 30 to 60 breaths per minute. And then I would auscultate the heart sounds, and apical, which is supposed to be 120 to 160, or 110 to 160. And so respiratory, so I'll check for the pulses, the brachial, the femoral, the leg, and the gluteal folds. And then for abdomen, I would check for bowel sounds, and then check if there are any masses. And then I would also check the umbilical cord at the same time and see if it's dry, and it should differentiate depending on when you're doing the assessment. And then for the back, I would check the neck and the spine, and then the Mongolian spot, and then for spina bifida, and I think there was like a dimple that you would look for. And so I'd go back to the top, and then you would check the range of motion of the arms, and then check and put the baby's arms up, and they should go back. And they should and then I would check for any respiratory distress with like nasal flaring, xiphoid retraction, and intercostal retractions. And then I would also assess like the face symmetry and see if everything is symmetrical. And then I think it's called the palliate. And I would check for the diaper and see if there's meconium or any urine that has been passed. And then I would also document the time, date, color, and amount, and also the odor, because meconium usually shows within 24 to 48 hours of birth. And I would also ask the mom like how the baby is voiding and how the baby is opening. And I would, if it's a male, I would palpate the testes and the scrotum and assess for the placement of the urethral meatus. And for women, I would check for all the labias, the labia minora and then majora, and then the clitoris, and then the patency of the vaginal opening, and note if there's any discharge. And while I'm there, I could check the femoral pulses, and then check for the patency of the rectum, if there's any redness or any signs of infection because of the diaper. And then I would check for the reflexes, the palmar and then plantar grasp, and if they're intact, and the Babinski reflex. And yeah, count all the digits and if there's any webbing, and then the palm creases, and then assess the hip for dislocation. And then if it is a C-section baby, I would observe for any injury during that birth, and they may have congestion related to the C-section birth. And yeah, so that's when I would wash my hands and document the findings.